CNA Patient Complaint Management. Welcome to the quiz. Question 1. You are reflecting on interactions with patients throughout your shift and thinking about the importance of reporting your observations to the nurse. You understand that your role as a CNA includes observing patients and communicating findings to the nurse. Based on understanding the importance of communication and reporting in nursing care, what is the primary reason for reporting observations about patients to the nurse? Option A. The main reason to report observations is to make sure the nurse has a lot of information to keep them busy and occupied during their shift. Option B. Reporting observations helps identify changes in patient conditions early, guides nursing assessment and intervention, and ensures that appropriate care is provided. Option C. You should report observations primarily so that you do not have to take responsibility for any problems that might occur. Option D. Reporting is mainly done to ensure that you are not blamed if something goes wrong with the patient. The answer is B. The primary reason for reporting is patient safety. Early identification of changes leads to timely interventions. Option B is correct. Options A, C, and D focus on staff convenience or blame, not patient care. Question 2. You are assigned to care for Mr. Lawrence, a 78-year-old male patient who has been admitted to your unit with advanced Alzheimer's disease. He is confused, does not recognize family members, wanders frequently, and sometimes becomes agitated and suspicious about his surroundings. He has difficulty understanding explanations and becomes frustrated. The nursing staff are trying to develop approaches to help make him more comfortable and reduce his agitation. Based on best practices for caring for patients with dementia and maintaining their comfort and dignity, which approach is most appropriate when caring for a patient with dementia? Option A. Correct the patient firmly every time he makes false statements or expresses confusion, and explain the facts repeatedly until he understands them. Option B. Reassure the patient in a calm voice, avoid arguing or correcting him, redirect his attention to familiar or comforting activities, and maintain a consistent routine. Option C. Leave the patient alone for long periods to prevent agitation, and only interact when absolutely necessary for tasks. Option D. Speak in complex sentences and use medical terminology to help him become familiar with hospital language. The answer is B. For dementia patients, validation and redirection are key. Do not argue or correct. Option B is correct. Option A increases agitation. Option C. Social isolation can worsen confusion. Option D. Complex language is confusing. Question 3. You are assisting Mrs. Dorothy Jenkins, a 75-year-old female patient, with her morning care. She has an 4-line in her left forearm. While you are helping her change her gown, you need to ensure that the 4-line remains intact and functioning. Based on proper technique for gown changes in patients with 4 lines, what is the correct method for changing a patient's gown when they have an 4? Option A. Remove the gown from the arm with the 4 first, pulling the tubing through the sleeve, then remove the other arm. Option B. Remove the gown from the arm without the 4 first, then carefully slip the gown off the arm with the 4 by sliding the sleeve over the tubing and the 4 site, ensuring the 4 bag and pump are not pulled. Option C. Cut the gown off with scissors regardless of the patient's preference. Option D. Disconnect the 4 tubing from the catheter to make the gown change easier. The answer is B. When changing a gown for a patient with an 4, remove the non-4 arm first, then gently slide the sleeve over the 4 site and tubing. Option B is correct. Option A risks pulling the 4. Option C is not necessary and may damage clothing. Option D. Disconnecting the 4 is outside CNA scope and risks infection or bleeding. Question 4. You are caring for Mr. James Patterson, a 72-year-old male patient who uses a cane for ambulation. You are assisting him with walking to the bathroom. You need to ensure his safety and the correct use of the cane. Based on proper ambulation techniques with a cane, on which side should the cane be held to provide the best support? Option A, on the same side as the weak or injured leg. Option B, on the opposite side of the weak or injured leg. Option C, in either hand, it does not matter. Option D, the patient should hold the cane with both hands. The answer is B. A cane should be held on the opposite side of the weak leg to provide a wider base of support and reduce stress on the affected joint. Option B is correct. Option A is incorrect. Option C, it does matter. Option D, canes are designed for one hand. Question 5. You are reviewing the policies regarding leaving patients unattended, especially those who are confused or at risk for falls. You understand that patient safety is the priority. Based on standards for supervising patients and preventing harm, which statement accurately describes when it is acceptable to leave a patient unattended? Option A. It is acceptable to leave a patient unattended for any reason, as long as you are not gone for more than 5 minutes. Option B. It is okay to leave a patient unattended for short periods if they are alert and oriented to person, place, and time. Option C. It is never appropriate to leave a patient unattended, except when you are called away for emergency situations involving another patient. Option D. It is acceptable to leave a patient unattended for extended periods if family members are present in the room visiting the patient. The answer is C. Patients should never be left unattended if they are at risk, and even alert patients should not be left alone in unsafe situations. The best answer is C. It is never appropriate except in an emergency where you must respond to another patient in crisis. Option A is unsafe. Option B. Even oriented patients can fall. Option D. Family presence does not eliminate the need for staff supervision. Question 6. You're attending an educational session about healthcare ethics and patient rights. The instructor is discussing the concept of patient autonomy and what it means for healthcare providers. Based on understanding of ethical principles in healthcare and patient rights, which statement best defines patient autonomy in healthcare settings? Option A. Patient autonomy means the hospital's right to make all healthcare decisions for the patient regardless of what the patient wants. Option B. Patient autonomy is the patient's fundamental right to make decisions about their own healthcare, including the right to accept or refuse treatment. Option C. Patient autonomy refers to the family member's authority to override the patient's wishes if the family disagrees with the patient's decisions. Option D. Patient autonomy is the CNA's responsibility to direct and control the patient's activities and medical decisions based on what the CNA thinks is best. The answer is B. Autonomy means the patient has the right to make informed decisions about their own care. Option B is correct. Options A, C, and D violate patient autonomy. Great job! Don't forget to subscribe. Bye.